Dr. Anu Vijayan will now enlighten us on the topic Mandibular Advancement Devices. It's our pleasure to invite Dr. George Abraham, prosthodontist and technical head, Denticare Dental Lab, with a clinical practice in Little Eden Pediatric and Family Dentistry, to kindly chair the session.
Dr. Anu Vijayan, professor in the Department of Oral Medicine and Radiology at Mar Baselios Dental College, has established herself as a notable figure in academia and research within the field of dentistry. She has earned a specialization in oral medicine and radiology from Rajiv Gandhi University of Health Sciences in 2014 with first rank and gold medal. Dr. Anu Vijayan pursued specialized training, completing a fellowship in temporomandibular disorders, orofacial pain, and dental sleep medicine from Roseman University, USA in 2023. She is currently pursuing a mastership in orofacial pain and dental sleep medicine. Over to you, ma'am.
Thank you. So, warm good afternoon to everyone present here. It's my immense pleasure to be here again in the second chapter of the SnoozeCon. I thank Dr. Sanu and Dr. Davis for carrying on the show forward, because I was there in the first chapter also. I never thought the second chapter will be happening. And also I thank them to adding dentists to this, as this is an interdisciplinary approach in management of the sleep-related breathing disorders. And as we heard from the eminent speakers in the previous sessions, we have an idea that OSA, it's a significant public health disease which is having a complex challenge in the management. We know CPAP is a golden standard for the treatment of OSA. But yes, we are in search of more acceptable and patient-friendly management protocols. And here comes the role of mandibular advancement devices. So in this session, we will explore how the mandibular advancement devices are going to bridge the gap in treatment of obstructive sleep apnea. So just a little bit about the history of oral appliances in the management of sleep-related breathing disorders. It was in the early 1930s, oral appliances were used for correction of the retromandibular position, which had indirectly a positive effect on the airway. And in 1970s and the early 1980s, oral therapy appliances came as a non-surgical option for the management of sleep-related breathing disorders. And in 2015, American Academy of Sleep Medicine put forward guidelines how to go with the management of obstructive sleep apnea with your mandibular advancement devices. And further on, FDA approved the mandibular advancement devices as a Class 2 durable medical equipment. So let's see, when we talk about oral appliances for the management of sleep-related breathing disorders, it's not just the mandibular advancement devices. There is something called as a tongue retaining or tongue repositioning appliances, which is not very commonly used because the efficacy of the appliance is not clearly proven. But yes, in patients who are having a completely edentulous arch, that is, they don't have the tooth to support the appliance, or in patients who have a large tongue, especially when they have sleep apnea in a prone position. In these patients, we can give them this oral appliance called the tongue retaining device. And according to the guidelines which was put forward by the American Academy of Sleep Medicine, they say sleep physicians should prescribe a oral appliance. That is, they should refer the patient to a qualified dentist for management of not only obstructive sleep apnea, but also the patients who complain of primary snoring. We know snoring is a common thing which is happening, and we hear commonly like, I sleep. Snoring means I sleep very well. That is a common concept among us, but that's not the right thing. Snoring is always a predisposer to sleep apnea. So the sleep physician, when the patient is complaining to you with a complaint of snoring, you should refer the patient to a qualified dentist for management with the oral appliance. And yes, once the patient is put with the oral appliance therapy by your dentist, the patient should be again recalled for follow-up by the sleep physician, and we should assess the efficacy of the appliance in the management by periodic polysomnographic testing. So what is this mandibular advancement device? So we have been hearing that CPAP. What is it? Continuous positive airway pressure. So similarly, mandibular advancement device, otherwise called as MAD, it is something which is working over the principle of continuous open airway therapy. That is, we are repositioning the mandible anteriorly, non-surgically, and we are creating a patent airway which is not falling back or collapsing while the patient is in a supine position or whenever the patient is using the appliance. So, we can see here the mechanism of action is by repositioning of the mandible. When the patient is taking in, when the mandible is set back, there is a block or the obstruction. So with the help of the appliance, what are we doing? We are repositioning the mandible, and indirectly the tongue, the soft palate and the low set hyoid bone is repositioned. So these structures which are repositioned are stabilized in the repositioned position, and the associated muscle, that is the genioglossus muscle, is also getting activated. Now indirectly what is happening? The patency of the pharyngeal wall, the wall is expanding not only laterally but also antero-posteriorly. So the caliber of the airway volume is maintained when the patient is using this mat. So the effect of the MAD, as I told, it increases the retromandibular airway as well as the retroglossal airway, and it improves the parameters which is being recorded in the polysomnographic study and improves the quality of life of the individual. Now let's see, is this MAD a choice for all the patients who's coming to your OP? No, not at all. There are certain criteria, as we saw, set by the American Academy of Sleep Medicine. You can only advise MAD to a patient who is falling in the category with a low AHI, that is mild to moderate obstructive sleep apnea, and also in cases of patients with severe sleep apnea who is not tolerating the CPAP, which is the patient is being using for a period of time, or in the patients, as ma'am said, we do maxillary mandibular advancements or the genioplasty. In these patients, when the surgery has failed or the patient has not responded properly even after the surgical procedures. But the overall outcome of your treatment depends on the phenotype and the endotype of the patient. So we have to select the patient accordingly, and a better response is got in these kind of patients, as Sir was telling, a patient with a lower BMI, a patient with low baseline AHI, a small neck circumference, and in the younger age group, and preferably a female patient. So when you're going to give an appliance to these group of patients, the amount of response or the success rate for your appliance therapy will be high when compared to the other group. And also when we check for the dentofacial or the maxillofacial features, if the patient is having a retrognathic mandible, patient is having a posteriorly positioned tongue, a shallow soft palate, and patient is having a low set hyoid bone. These patients also respond well to your oral appliance therapy. So once the patient is coming or has been referred to the dentist for the oral appliance therapy, there are several things which come to our mind, like what kind of appliance we are supposed to give to the patient, what should be the design of the appliance, what is the choice of material to be taken, when should I call the patient for follow-up, is my treatment working for the patient. So let's see the kinds of appliances which are available. So basically there are two types of appliances. One is the non-custom made appliances and other one is the custom made. So as the term says, non-custom made is available over the counter. You open the Amazon shopping site, when you type treatment for snoring, you can see several appliances which is available. You just purchase it, put inside the mouth, they say it helps for snoring. Maybe it can stop your snoring for a particular limit, but again the disadvantage of these appliances is that it is a non-customized one, means everyone who is sitting here will have to use the same appliance. So the appliance cannot be titrated. So what do you mean by titration? Titration means we are adjusting the appliance according to need of the patient. The amount of titration needed for a patient with a mild OSA is not the same as the one which is needed for a severe OSA. So there comes the custom-made appliances which is available where the patient walk-ins to the dental office, consults with the dentist will take the impression of the patient's maxillary and mandibular teeth, and they will send the model to the lab, and where the lab will fabricate these kinds of appliances. So there are many appliances which are available in the market from different laboratories. And the advantage of this custom-made appliance is that as it is made according to the requirement of the patient, we can titrate, the patient has a better comfort, the fit and retention of the patient is better, and the compliance of wearing this appliance is good when compared to the other one, that is a non-custom appliances. And next is a type of appliances, the custom-made appliances, how this is going to work in the patient's oral cavity, or how is it going to advance the mandible of the patient. So again, this can be a hinge-based mechanism, a pull-based mechanism, traction or a compression-based. I'm not going to theory of these. I'll just show few appliances which is working on this principle. So this is something called as a Herbst appliance, which is working on a compression base. So this is the video of the appliance. Sorry. So you can see how the upper one is the maxillary component and the lower one is the mandibular component. And there are two rods which is connecting the upper and lower component. So the appliance is working on a compression mechanism wherein two rods are inserted into each other. And there is a keyhole here which helps to, you can see, the arrow, the black arrow on the first picture, that is a keyhole wherein you put the key and you will expand or you will titrate the advancement of the mandibular component. So this was the Herbst appliance. And the next appliance which we have is the dorsal fin appliance. You can appreciate a triangular shaped fin on the mandibular component, and there is a expansion screw which is on the maxillary component. Now, how we do this appliance is that you can see on the buccal surface of the maxillary component, the screw is attached, and in the screw, we will activate with a small key so that when you expand the screw, it will push the fin anteriorly. So together with the fin, the mandible is also moving forward. The next type of appliance which we see in the mandibular advancement devices is the elastomeric mandibular advancement appliances, wherein we are using certain elastomers, the yellow strap that is fixed to the maxillary and the mandibular component, that is the elastomers, which we fix to the buccal surface, certain buttons on the buccal aspect, and we put it inside the patient's mouth, and the patient will be advancing the mandible according to the type of the strap which we are giving. That means the straps are available in different compression like soft, firm, extra firm, and also different lengths of straps are available. So how much ever we want to advance the mandible, we will change the straps accordingly. And the next one is a dream tap appliance. That's a Thornton's anterior positioner. So we can see in the previous ones, we were seeing the activating system was on the posterior teeth region, whereas here the mechanism, the coupling is attached to the anterior teeth region. So again here, it's the hinge-based mechanism, and we can see the screw can be attached either to the maxillary or the mandibular component, and we connect the key into the block, and the patient can move the jaw laterally and anteriorly. So that is the most advantage of this appliance. You are not hindering the movement of the jaw, and you have to be little careful when giving this appliance to the patients who are wearing veneers. Veneers means certain aesthetic coverages which is given to the anterior tooth, and also in tooth if it's not periodontally very strong. So in such conditions, you are not supposed to give this appliance. Then we have in the market OSA appliance. They are having a nasal pillow. You can see in the upper maxillary component, there is something which is extending here. So that is a nasal pillow which helps to expand or open up the nares always. So a patent nasal airway will be kept. And also in the mandibular area, there will be certain lingual buttons in the inner aspect which helps to position the tongue always in an upper position. And this is one which is Ovendus appliance. This is the same as the EMA appliance which I showed, but the difference is that we have an anterior opening or a valve which helps in mouth breathers or in patients who have nasal congestion. This is available in our dent care lab also. We have Dr. George with us. He's the head of that, and he has brought the appliance. If you want to see the appliance, you can have a look. Now, I told we have to titrate this custom-made appliances. Now, how are we going to titrate? Titration means activation of the appliance. So, the first picture is showing the expansion screw, and the other one is the key of the appliance. So, you insert the key into the screw, and you can see a yellow arrowhead which is directed upward. That means the direction is showing towards which you should change the screw or open up the screw, so that every 180 degree of rotation will open the screw for a particular amount. Say for a particular appliance it will be 0.25 millimeter, maybe for some appliances it will be 1 millimeter. So according to the appliance which we are prescribing to the patient, we should activate, and be careful that always activate on both the sides. Never activate on a single side and send the patient, and also not to give the key to the patient. So we have to follow up the patient every 4 to 6 weeks initially, and later on during a period of 3 months, at least minimum of 4 to 6 follow-ups should be conducted. And this is the elastomeric appliance I already spoke about. So we have the activation by changing the elastomers which we are applying on the buttons. Now how are we going to assess the efficacy of this mandibular advancement device? So as I told, strict follow-up necessary after giving the appliance for the patient, and we assess the improvement by testing the neurocognitive improvement, like asking the subjective evaluation of the patient, the cardiovascular improvement, the factors has been improved, and we take the questionnaires to record the quality of life. And researchers have found that for this non-CPAP treatment, that's oral appliance therapy, we can go with a level 3 sleep study, or as an alternative, we can carry out a pulse oximetry study to assess the efficacy or the response to the treatment. Now comparing this MAD with the CPAP, we all know CPAP is the golden treatment, but yes, MADs have found efficacy or positive outcomes in the improvement of the quality of life of the patient, and the main advantage is that the compliance rate of the patients carrying out or using this appliance is more when compared to usage of the CPAP. CPAP on an average, it is said that the patient uses the appliance for only 4 hours per night, whereas when a patient is on a mandibular advancement therapy, the researchers have found that around 7 to 8 hours of usage is being used by the patient. So, and again, the advantage is that compliance is good and transportability. If the patient is a frequent traveler, it is difficult to carry the CPAP machine with him. And also in the areas where there is a shortage of power supply, they cannot use the CPAP, even if they are available without power also. But yes, these are the advantages of the mandibular advancement device, and comparatively, it is cheaper as an investment when compared to the CPAP. But again, even though there is an advantage, it has its side effects also. It creates transient changes in the patient's occlusion. Like when the patient is wearing the maxillary and the mandibular appliance, what happens is that it sometimes causes proclination of the anterior teeth and retroclination of the lower anteriors. So some patients might be more concerned about the aesthetics. And some patients, what happens, we are repositioning the mandible anteriorly, right, during night time. So when they wake up in the morning time, they say they have pain in the muscles. They have the soreness of the muscles. They have pain in the temporomandibular joint region. So in such situations, we can just use these kind of things. These are called as the morning aligners. It is just a resin or a thermoplastic thing which we can soften and ask the patient to keep inside the oral cavity in the occlusal plane and chew over it so that the muscles get readapted to the normal position. And also we can ask the patient to do the tongue up exercise to keep the tongue posteriorly in the palatal region to reposition the condyle posteriorly. And we cannot prescribe the mandibular advancement devices even though if the patient is in a mild OSA category. If the patient is having central sleep apnea, we have to be very careful. Patient is not in a central sleep apneic patient. If the patient is having severe respiratory disorders and severe nasal congestions, it is contraindicated. If the patient has a poor tooth, a periodontally weakened tooth, who cannot take the support from the tooth, you cannot give the mandibular advancement devices. Severe gag reflex in patients under the age of 18, where there is still a growth potential. When you advance the mandible, what will happen? It will change the growth pattern of the body of the mandible. And again, in prognathic mandible, we cannot further advance the mandible anteriorly. In such situations, we cannot go for a mandibular advancement device. So, the studies have found that the benefit clearly outweighs harm, as in primary snorers, the oral appliance therapy has a high evidence of efficacy. And in case of obstructive sleep apnea, this Mandibular Advancement Devices has a moderate level of efficacy. And I would like to share a case which was treated with the Mandibular Advancement Device. So the patient who was already undergone palatopharyngoplasty came to us for management with the appliance, oral appliance. So his AHI was initially 38.9. The patient was we took an investigation and we took a CBCT, and it was found that even though the retrognathia which was appreciated was very less, he had a deep bite, anterior deep bite. So we opened the vertical dimension as well as we did the advancement with the appliance. So you can see this is elastomeric appliance which is given to the patient. Elastomeric appliances always can be given as a trial appliances before proceeding to other kind of appliances. And the patient, after a period of 3 months, sleep study showed a decrease in AHI to 20.4. So I cannot say this is the success level of treatment with this is fully accomplished. But since the patient is not available, he's in New Zealand. He's always in a telecommunication with me, and he is symptomatically better and happy. So I would like to conclude saying that Mandibular Advancement Devices, they are not just an alternative, but an evidence-based and patient-centered solution in obstructive sleep apnea care. And their role in this mild to moderate cases is well supported, and their compliance makes them clinically valuable. So I thank all of you for your patient listening, and I'm so happy that these kind of cases of the obstructive sleep apnea, not only the obstructive sleep apnea cases, we can also manage or help the patients with other sleep-related breathing disorders like bruxism also with these kind of oral appliances. So thank you. I would like to acknowledge my mentor, Dr. Larry Lockerman, who took me into this field of dental sleep medicine, and also thank you all for your kind and patient listening. Thank you.
Thank you, Dr. Anu, for that enlightening session. It's me here. I think, yeah. So thank you for that wonderful lecture. Any questions? I don't think we have time for many questions, but it was very enlightening because our non-dental friends do not know much about MADs, but I know many ENT surgeons like Srinivas Kishore sir who practices MADs, when using dice and all of that. So thank you so much. Any questions? All right, so I think we can proceed. Thank you.
Thank you, ma'am. Thank you, sir. I'd like to request Dr. Gracie Marcos, Senior Consultant ENT Specialist at the Oracle Medical Center, Kothamangalam, to kindly felicitate the chairperson.